A pleasant morning to you, sir. I am Hasmin Gani from BSN1-D, and for today's return demonstration, I'm going to perform the parental administration, which is the intramuscular, intradermal, and subcutaneous injection. So I'll begin with the intramuscular injection.
The first thing to do is I'm going to clean the rubber stopper with an alcohol swab. And after that, I'm going to remove the cap from the syringe. Next is draw air into the syringe by pulling back the plunger. Fill the syringe with air up to the same level as the medication dose. Push the needle through the top of the vial and inject all the air into the vial. Turn the vial and syringe upside down so that the needle points upward. Draw back the plunger to fill the syringe with the correct amount of medication. And then, I'm going to remove the air bubbles by gently tapping the syringe and pressing the plunger, so avoid touching the needle to ensure stays clean. So now, I am going to locate the injection site and gently spread the skin between two fingers and keep the muscles relaxed. So I am going to clean the skin with the alcohol swab with a circular motion and to allow air dry. Next is I'm going to inject the medication, so I'm going to insert the needle into the muscle at a 90-degree angle. Use the index finger and thumb to stabilize the syringe while using the other hand to pull back on the plunger slightly to look for blood. So I'm going to aspirate. So if there is a blood, it means the needle is in a blood vessel and not a muscle. Withdraw and start over with a new needle, syringe, and injection site. And if there is no blood, the needle is in a correct position. Press down on the plunger of the syringe to inject the medication. And after that, I'm going to remove the needle from the skin and put the cotton balls with alcohol to the injection site and apply light pressure. And you can also use a band-aid if necessary. So let's proceed to the intradermal injection. So the first thing to do is I'm going to put the prescribed medication into the syringe. Next is I'm going to clean the site with an alcohol swab or antiseptic swab. Use a firm and circular motion. Remove the needle from cap by pulling it off in a straight motion. Using a non-dominant hand, spread the skin taut over the injection site. Hold the syringe and dominant hand between the thumb and forefinger with the bevel of the needle up. Hold the syringe at a 5 to 15 degree angle from the site. Place the needle almost flat against the patient's skin. Bevel side up and insert needle into the skin and insert the needle only about 1/4 inch with the entire bevel under the skin. Remember, if the injection is a TB skin test, circle the area around the injection site to allow for easy identification of site in 3 days. Let's proceed to the subcutaneous injection. Clean the rubber stopper with an alcohol swab, assuming that it is a insulin. Remove the needle from cap by pulling it off in a straight motion. Turn the vial and syringe upside down so that the needle points upward. Draw back to the plunger to fill the syringe with the correct amount of medication. and then remove the air bubbles by gently tapping the syringe and pressing the plunger, so avoid touching the needle to ensure it stays clean. Clean the skin with the alcohol swab with a circular motion. Grasp or pinch the area surrounding the injection site to create a skin fold if there is a little adipose tissue. Hold the syringe in the dominant hand between the thumb and forefinger. Insert the needle quickly as a 45-degree angle. Withdraw the needle quickly at the same angle at which it was inserted. While supporting the surrounding tissue with your non-dominant hand, engage the needle safety system immediately. Apply gentle pressure at the site after the needle is withdrawn and do not massage the site.